Hello, beautiful. Welcome to my free masterclass, Why Your PCOS Treatment May Not Be Working for You. And we will be busting some myths around PCOS, and we will also see what really works. So PCOS is a topic I'm super passionate about, and I'm so excited to bring this masterclass to you. And unfortunately, I see a lot of women struggling with PCOS unnecessarily. And in my opinion, a lot of PCOS is a very complicated condition. It is multifactorial. And in my opinion, a lot of cases are approached incorrectly. And that is the reason I bring this masterclass to you. So let's dive deep and let's get started. So, by the way, if your PCOS treatment is not working for you, it is not your fault. The only reason you are not hormonally healthy is you're not getting the right information, and this is what I'm going to give you today here. So before we get into it, just a little bit about me. My name is Dr. Disha, and I'm a gynecologist obstetrician based in Bangalore, India. And my private practice is completely focused on women's hormones, and PCOS in particular makes up more than 80% of my practice. Now, PCOS is something very, very close to my heart because I know PCOS not just as a doctor, but as a patient. Yes, I have suffered from PCOS in the past and I have recovered from it. And for that particular reason, I've decided to focus and specify my practice to this area. And so that I can, really help women as much as I possibly can. And although I do other work also, I deliver babies and I handle other things, but hormonal health is the main core of my practice. And that is something which I can personally relate with and I'm super passionate about. So, the reason I decided to become a gynecologist doctor with this particular focus is because poor hormonal health is something I have personally struggled with my entire life. And I really experienced firsthand how awful your hormones can make you feel when they are not working properly for you. And for me, it really, really started very early on with irregular periods and severe cystic acne. And I'm not talking about just one pimple here or there. I'm talking about multiple painful cystic acne on my face, especially on my jawline, and especially at that time of the month. You know what I'm talking about. And it was a really horrible time in my life as a teenager. And I really did not know what was going on with me. I did not feel like leaving my house. It really took to my self-esteem. I canceled plans all the time because I was just way too self-conscious about other people seeing me. And to be honest, I missed out on a ton of stuff in my very formative years because I was just very, very self-conscious. I did not want to travel. I I did not want to socialize. It was really, really awful. And at the end of the day, this is what PCOS can do to you. It can completely get to your self esteem, and you have nothing left by the end of the day. And in addition to acne, I was also having other symptoms. Like, I had extremely long cycles. They were never less than 40 days uh, long, and they were always like beyond 40 days. And whenever they used to come, the periods were so painful, the cramps, the painful periods, which I thought was normal, but it turns out that it was not. And the worst of all, my mood, for at least 2 weeks before my periods, I used to have major PMS. I did not feel like myself, and those times were really insane. I felt I was a different person. I was ticking time bomb, and I knew that how unpleasant I was to be around during those times of the month. So overall, I really just didn't feel like myself, and I felt completely out of control with what was happening to my body and my hormones. And then I decided I wasn't going to live like this anymore. So, almost after a decade of suffering from these symptoms, I finally received my diagnosis. And sadly, this is not a situation unique to me. Most women with PCOS need to go through multiple doctors in order to receive accurate diagnosis. So anyway, after I was diagnosed, I took many more years to figure out what treatment really worked for me the best. I was taking birth control pills and metformin to mask my symptoms, but sadly, it didn't heal anything. It rather pushed me into premature menopause and autoimmune thyroid disease in my mid 30s. And my symptoms at that time was just, very tragic situation. I was 90 kg in weight. My skin was filled with acne and I was not getting my cycles at all. After stopping birth control pills, I my cycle went completely missing. I was diagnosed with premature menopause, and the kind of prognosis given to me was not great either. I was told that I am at high risk of, full-blown diabetes, blood pressure, and even cancers in the later life. And I just didn't know what to do. I didn't have the right practitioner really telling me what to do. And anyway, I did end up figuring out. I took a break from my practice and I had no other option. I had to figure this out. I decided this is not my prognosis, this is not my future, and I will change that. And I threw myself into researching anywhere and everywhere I could. And whatever I ended up figuring out, it just transformed my life. I cannot even begin to explain the relief that I felt. And I'm really happy to say that PCOS is a thing of the past. It's not even a thing actually I think about in my day. And I'm happy to report that not only my period came back, I now have a very healthy, regular menstrual cycle. My skin completely cleared up. As you can see my skin. This is my real skin. I'm so happy that I can enjoy clear skin all month long, not even one bump here and there. And of course, my energy lifted, my mood lifted, and I could experience a healthy pregnancy in my 40s, which is supposed to be an advanced maternal age. And I want you guys to experience this exact same relief with your PCOS, because you can feel so much better. It is possible. So that's enough about me. So let's get started. I know you guys are eager to know and learn more about PCOS. So the first, let me talk about the most common PCOS myths and why what you're doing may not be working for you. So let me share the most common PCOS myths, and I will be debunking those myths because not only I have had a huge success in managing my PCOS, but hundreds, actually thousands of my clients at this point in time have used these principles to reverse their PCOS, and you can too. So the biggest myth about PCOS is a PCOS is a problem in your ovaries. Okay, so nothing could be further from the truth. PCOS is a multi-system hormone imbalance condition, and the root cause is never in your ovaries, but somewhere in your metabolism, ladies. Okay, so if you want to look at the root cause of the root cause of PCOS, it is somewhere in your endocrine system, and it can be different for different people. And that is why there is no quick fix or magic pill to reverse PCOS. You may have to create long-term lifestyle changes around detoxification and your period cycle. And what do I mean by that? That you want to do things in a feminine way. You have to learn the feminine way of detoxification, which I don't think many people, not anybody is talking about, because at the end of the day, we are women, we are not like men, we are completely different from men, and we cannot do the same things which men are doing, like, crash dieting or intense exercise or even intermittent fasting for that matter. So myth number 2, this is a big one, ladies, that diet and exercise can fix your PCOS. Okay, and these days there's a lot of awareness. Women understand that they should not be popping up birth control pills, and they are trying to do intense dieting. They are drinking green juices, they are doing yoga. Some of you may be gymming and literally killing yourself in the gym. So the myth that diet and exercise can end all the PCOS symptoms is it's a big one, okay, and in collective consciousness right now. So you have to understand that there is a ton of really amazing research on diet and exercise for PCOS, and I've seen a lot of my patients hit their goal and see big changes with diet and exercise as a part of their treatment plan, at least initially. But I think that is overemphasized, and focusing too much on diet and exercise is not fair. It is almost like you didn't consume this perfect diet or you didn't exercise 7 days a week. It is your fault that you're not losing weight, okay, or your acne is not getting any better, or you're not getting pregnant. So um, that's completely unfair, because PCOS goes much deeper than lifestyle modifications. And you already know this. If you're watching this webinar masterclass still here, I'm sure you're not a junkie. Most of the clients coming to me are already health rock stars. They are trying to eat extremely clean diets, and if anything, they are over exercising because they have read online, or maybe their doctors have told that you need to lose weight if you have PCOS. And guess what? That actually intense exercise can make your symptoms worse. Okay. So when we talk about how to incorporate a balanced diet and exercise regime, in addition to right supplementation for their particular type of PCOS, this is the time when we see the best results. And a ton of my patients have been shocked to see that when they stopped doing so much HIIT, then they are actually able to lose weight that they hadn't been able to in many years. So the reason why this has happened, and we are going to go over this a little bit more in detail later on, but you want to understand that there are different types of PCOS and there are different factors when it comes to PCOS, and knowing which type of PCOS you have, as well as the contributing factors, not just the physical, but also mental, emotional factors that are most prevalent for you specifically. That will help to determine if exercise and diet will be of help to you, as well as it will help you to determine what type of diet you should be eating and what intensity of exercise you should be engaging in. So the silver lining with this myth is that PCOS is not your fault. You are definitely not making this worse for yourself. And there is something deeper in play. And first step is getting better at understanding what is the root cause. And if you have a stress type of PCOS, like which I called as adrenal type of PCOS, exercise can actually backfire, and it can actually lead you to put on more weight. So if your current healthcare provider is making you feel bad about your diet, or making you feel like you're lazy and PCOS is your fault because you're not strictly adhering to some crazy diet or crazy exercise regime, then it's time to work with someone else. Okay, so myth number 3, you need to have cysts on your ovaries to be diagnosed as PCOS. Okay, so this is again a big one, ladies. And the truth is that not all women with PCOS have cysts on their ovaries, and many women without PCOS do have cysts on the ovaries. Okay, so although the presence of cysts is supposed to be a diagnostic criteria, it is not very accurate, and it is likely to be revised, because when you take birth control pills, and you may see that the cysts may vanish, but it doesn't mean that your PCOS is completely healed. The cysts are just a side effect of the metabolic problem and may come and go when the root cause of PCOS continues to persist. So if you have been treating your PCOS and your cysts are coming and going, but your symptoms are still there, you need to know the root cause tests. Okay, so you can either consult me, or you can consult any other local integrative gynecologist who can help you to figure out the root cause of PCOS and heal it from the root cause, so that the solution can be long lasting. So I'll be coming to what are the types of PCOS a little later in the slides. Okay, so myth number 4, synthetic hormones or birth control pills will cure your PCOS. And we sort of touched on this in the initial slides, but basically synthetic hormones can only mask your symptoms. They do nothing to heal your PCOS. I know when I was first diagnosed, this was the only treatment that I was offered, and I took it because, I was desperate for my symptoms to go away. And there is no judgment if you are taking it. I have done all of that. Okay. And I will definitely say that pretty much all of my symptoms were beautifully masked while I was taking those pills. My skin was probably the nicest, and my period was like a clockwork. I did not experience any PMS, but it did come with a lot of side effects, which eventually led me to come off the pill later. And oh my God, like when I came off the birth control pill, my acne and my PCOS was way worse than ever before. It was like very, very severe. And the reason that happened is because birth control pills, they are not fixing the underlying cause or any root cause of PCOS. It really, really does nothing to heal you. It can beautifully mask your symptoms though. So, what birth control pills do, they completely shut down your natural cycle and hormone production, and they provide a very specific dose of synthetic estrogen and progesterone. And since a lot of hormones, a lot of symptoms of PCOS are hormone related, we experience a great relief on the birth control pill. But under the surface, when you are taking the birth control pill, many of the root cause of PCOS are actually getting worse. And those include things like inflammation, insulin resistance, abnormal stress response, functional changes in your thyroid, adrenal glands, gut flora. They permanently damage the gut flora, liver congestion, and much, much more. And that is why when you come off birth control pills, PCOS can feel a lot worse for a while. And it personally took me many, many years to recover once I came off the birth control pill. And something even worse happened to me. My periods completely vanished after stopping the pill. Okay. And you may call it post pill amenorrhea or whatever, or premature menopause. But the main takeaway I want you guys to remember here is that birth control pill is not a cure. It is just a quick temporary fix. It is really beautiful at masking your symptoms, but it's just a mask. And if birth control pill is working for you, then that's amazing. I'm glad for you. But when you're ready to come off the pill, do not do it alone. Seek help. And also, if pregnancy is something on your radar in the near future, then this is probably not the best choice of treatment for you. You may want to heal the body from the root cause rather than mask your symptoms with pills, because a healthy baby grows in a healthy body. Period. There are no shortcuts. So the next myth, ladies, that PCOS is just a menstrual and fertility problem. And I have had women come to me who said that I'm not keen on childbearing and I'm not even concerned about the cosmetic thing. So why should I bother about PCOS? But the thing is that PCOS is a road which leads to bigger diseases in later life. And I'm not making this up. We have studies proving that. In 2009, National Institute of Health published a very important study called Biocycle Study. I think I have included a slide in this presentation later, and I will talk about that a bit later. But now you want to understand that PCOS is not just a menstrual and fertility problem. It is a road which leads to bigger diseases in later life, like full-blown diabetes, autoimmune disease, and even breast cancers, endometrial cancers, and some other kind of cancers. And this is not funny. I think we need to talk more about this and nip PCOS in the bud itself so that we can prevent a lot of cases and bigger diseases in the future. Okay, so myth number 6, all women with PCOS can be treated the same way. And this is so ridiculous, but this is actually the kind of treatment offered. Most of the women with PCOS are offered the same kind of treatment, like the birth control pills and metformin and advice to lose weight and come back in 6 months and stuff like that. So now this myth probably explains more than anything else. It is experienced by all of us. Okay, so and this cannot give you the results you want. Most of us have been prescribed a birth control pill, metformin, a low calorie diet, or some catch all treatment and lose weight and exercise. And although some of the treatments can be effective, it is not necessarily going to be effective for every woman with PCOS. And that is because no two women with PCOS look the same. And as I mentioned, PCOS comes in all shapes and sizes. There are actually different types of PCOS as well as different contributing factors to your PCOS. And the things which need to be carefully considered before starting any kind of treatment is, what is the root cause of your PCOS? Just taking a supplement because it is found to be helpful in some research study does not mean that it will be effective for your kind of PCOS. And that is why the PCOS programs that give the same treatment to everyone or offer a one size fit all approach, they cannot completely cure or give long-term solution for PCOS. Effective treatment means specific and customized to you. And we are going to talk more in a moment about how you can figure this out. But the takeaway here is to ensure that if you're receiving treatment from a healthcare provider, it's not just a catch-all treatment. Make sure that the person really understands what is happening with your PCOS and that is being targeted to treat the root cause of the problem, your particular type of PCOS. So myth number 7, that you are a victim to your PCOS. Okay, and this is my favorite one because the truth is that, okay, so you can actually totally fix your PCOS with an integrative approach, addressing the root cause of the problem using nutrition therapy, natural supplements designed for your root cause, lifestyle hacks, stress management, self-care, connecting with your feminine energy, and detoxification done in a feminine way. Although, hormones are important and PCOS is a multiple hormone imbalance condition, I just want to tell you that hormones are not the only factor here. Okay, it is true that PCOS is a hormone condition and your hormones are definitely imbalanced. However, balancing your hormones is only one piece of the puzzle. This condition not only affects your hormones, but also impacts your digestive system, how your body responds to stress and food and sugar. It can also affect your mental health, your cardiovascular health, and very, very other serious problems can happen, and the list can go on and on. And that is why PCOS can be so difficult to treat. And that is why many doctors may just give you birth control pills, metformin, tell you to lose weight, maybe some vitamins, and send you out of the door. And there is no judgment here. I was that doctor. I was myself doing this kind of treatment many years back. And till I was actually taking this treatment personally, and it did not work for me. So there is no judgment here. I say this with a lot of love. It's really not just about your hormones. I personally see this as a whole body, whole system condition. And in addition to working on your hormones, there is a whole lot more to be addressed for treatment to be effective and lasting. And again, this ties into which contributing factors are more prevalent and what kind of PCOS you have. But needless to say that only balancing hormones is also not enough. You have to also learn about feminine way of detoxification, mental healing, emotional healing, connecting with your feminine energy, and address any other wounds specific to you, which I am able to do for my clients. So PCOS is not your enemy, ladies. I will go to the extent of saying that PCOS is a blessing in disguise. It may be too much for you to take at this point in time, but that is the truth. You can actually use PCOS to up level in each and every area of your life. And that is what I have seen in my experience, and hundreds and thousands of my clients who have done this work. When they heal their PCOS, not only they become healthy, when they balance their hormones with a holistic approach, not only they become healthy in their physical bodies, like that is a given. Something even more beautiful happens to them. They get connected to their passion and purpose in life. They start doing things for the betterment of family, community, and the world at large. And they actually become change agents in the world. And this is the most beautiful part of my work. Now, this slide is the most important slide of this masterclass because I want more and more women to be aware of it. And this talks about a very important study called Biocycle Study, which was published in 2009 by National Institute of Health. And the study basically lets us know that hormone imbalance in your 20s and 30s sets the stage for big disease of inflammation in your 40s and 50s. Okay. And what are those big diseases? Like full-blown diabetes, autoimmune disease, thyroid, heart disease, and even cancers. Okay. So are you even joining the dot, ladies, that your period problems in your 20s, something as simple as your PMS or cramps or maybe PCOS is setting you up. It is increasing your risk of deadly diseases in later life. Okay. And it's not even funny because I have been there and I don't want anyone to go through this. So this kind of a mindset that it's normal to have period cramps, it's normal to have PMS, it's normal to go for infertility treatment, it's normal to have postpartum depression after having a baby. This kind of mindset is not doing a favor to us because it is not setting us up for a long-term health and vitality, which we all deserve. And the good news is that it's very easy to reverse these problems in your 20s and 30s as compared to when you already develop a bigger problem in later life. And that is why I'm here talking to you today, to be aware, to talk about this. And I don't know why not many people are talking about it, but I want you to be aware and talk about this and be aware that you don't want to ignore your period problems. They are, your periods is actually considered as a vital sign of health by according to the new criteria. So don't ignore your period problems, even if you are not keen on childbearing. It doesn't matter. Your period is your health. It is your beauty. It has to be there for you. That period health is equal to your health and vitality, regardless of your reproductive goals. So now you understand that masking symptoms does not work. And now I want you to see what really works. And today I'm here to share with you, I'm going to give you a little bit taste of my, recipe, which I have created. And although it is not like, as I told you, it has to be customized. It depends on your own particular wounds also. But this is in general, like some things which most of you can benefit from. So I'm going to give you the taste of my protocol. And I'm also going to take you through each and every step of the protocol and share some fun science behind how all this works. And I think science is important, ladies, because the more you know about how your body works, the more you are able to work with the body. Okay, so the first step of the protocol is balancing your blood sugar, like managing the insulin. Insulin is the hormone. All of us know insulin. It is because of diabetes. I'm sure all of you know about insulin. So that is the first step of your protocol. And also you want to fill any nutritional gaps in this point. Any deficiencies have to be handled by using food as medicine. So the second step of the protocol is about balancing cortisol, which is your stress hormone. The third step of the protocol is about balancing your estrogen, and we do that by supporting the liver pathways and pathways of elimination. And the fourth step of protocol is more of a maintenance kind of protocol, which you have to do long term. So the first step, let's talk about the blood sugar and why I have presented in this sequence, ladies, because this sequence is also important in my research about endocrine system. The way the endocrine system works, it's very, very important that you follow the sequence because insulin is the first place to go. If you go anywhere else, it may backfire. Okay. So how many of you have done some kind of a juice cleanse or a fasting kind of thing and it made you feel bad? Okay. Because doing detox in the wrong order can actually make you feel worse. And that is why the first thing I want to start women who come to me, they work with me. I have many beautiful private clients who work with me. And the first thing I get them started, I get them started is on to balance the blood sugars and break the blood sugar roller coaster problem. And one of the simple things which you can do to overcome this problem in the morning is don't do caffeine the first thing in the morning, empty stomach. Okay. I know it's a big thing. I know it's a morning ritual. I know that cup of tea, cup of coffee, how much we love. It's a big crutch for a lot of women, as a lot of women are dealing with adrenal fatigue, and with the tea and the coffee, they kind of get going. But if you can just have your breakfast first and then have your tea or coffee to begin with, this small switch can do you a huge favor in terms of blood sugar stability and adrenal health. So the second piece is about balancing your cortisol, which is about healing the adrenal fatigue. And most of you with hormone issues are also feeling tired. So that is why you don't want to detox without supporting adrenals. And you can definitely take some adrenal supporting supplements based on your blood test. But one of my tips is to pack your day with nuts and seeds, especially sunflower seeds, which are actually rich in B vitamins and zinc, which can help to support your adrenal glands, and it can actually balance the cortisol. Now, the third piece of the protocol is about supporting the liver detoxification pathways. And here we talk about a very gentle form of detox. And once we do the step 1 and step 2, it actually does not make you feel worse. And in order to support the liver, one of my favorite tips is to boost up on your leafy greens and cruciferous vegetables, which actually help liver to metabolize estrogen faster, being rich in indole 3-carbinol. And it also gives you soluble fiber, which is actually moving the broken down estrogen through your intestines as quickly as possible. And the fourth step of the protocol is about hormonal optimization, where you align with your menstrual cycle by cross training your life, and you literally design your life based on your menstrual cycle. And this is not a new concept. Our ancient grandmothers, great grandmothers already knew this, but somehow we have lost this in the modern culture. So it's about reconnecting with your feminine energy, honoring your menstrual cycle, and designing your menstrual cycle based on where you are in the cycle. If you want to dive deeper into these concepts, there are blogs on my website. You can check them out. And the fourth part of the protocol is about hormone optimization. It is about working with your menstrual cycle, aligning with your femininity and menstrual cycle, and designing your life around your menstrual cycle. And this is not a new concept, ladies. Our ancient people, great grandmothers, and all already knew this. They used to follow certain rituals at certain times of the period cycle. And we have lost this knowledge, and it's time to revive that. So, this is about connecting with your feminine energy and honoring your periods. So, the summary of the protocol, summary of True Healing Protocol is it's very simple. It has 4 key steps. So first part is about a little cleanup, a mild detox, blood sugar regulation. Because if blood sugar does not go well, the endocrine system won't be happy in terms of hormonal balance. The second part is, of course, we talk about nourishing adrenals and flushing cortisol and all about stress connection, magnesium deficiency, and all sorts of deficiencies. The third part is about improving elimination and supporting your gut health, gut microbiome, and correcting the dysbiosis. And the fourth part is my favorite part, where we do the maintenance piece. We'll start connecting with the feminine energy, living in alignment with our period cycle, and we literally eat, exercise, and organize our life around our unique female menstrual cycle and around our hormones. And this part of the protocol is what I call SHEATO method. I created an acronym called SHEATO, as in CHEATO. And this acronym stands for the following principles applied to women's health. C for cyclic. Okay. The key thing is that we are not like men. We are actually very different from men. And we have to honor this fact. In fact, I think the biggest act of our generation could be to honor who we are, to honor that we are cyclic. We are not linear like men. We don't have to be like men in order to be healthy and happy in this world. H for hormone friendly. E for eliminate inflammatory stuff from your life, including the foods, including the thoughts. A for alkaline. Introduce alkaline nutrition, alkaline mind-body connection. Remember that love is alkaline. And TO is about being mindful of carbs. It literally stands for keto. And this TO part is like being mindful of carbs. So we don't have to completely avoid carbs like in keto. As women, we need some carbs, and how much you need depends on your metabolic type, which can be calculated. And you can plan your life around this formula, which can literally give you a stepping stone to fix your PCOS from the root cause. So the Shito method is all about honoring your feminine energy and period cycle. And this method allowed me to reverse my Hashimoto's disease, which is autoimmune thyroid, premature menopause, and PCOS, to experience a healthy pregnancy in my 40s. And it has also helped hundreds of my clients reclaim their health and create the life of their dreams. And of course, the babies of their dreams. So let me share some of the success stories, and we get extraordinary results for women because we work with them in their day-to-day life. I, literally really roll up my sleeves and really help them to navigate this thing and, figure out the root cause of the problem, be a detective and literally find out the root cause and navigate this with food, lifestyle, natural supplements, detoxification, self-care, self-love, mind body medicine. These are just some of the tools I love to use. So here are some of my favorite success stories, and there are so many of them. If I start talking about everything, the presentation will become too long. So I'll be just addressing a few here. Rest of the stories, if you want, you can check the success stories page of our website, www.truehealing.com. So story number one is about Sneha Sunagar. It was a case of PCOS and infertility. And when Sneha came to me, she is a great example of what is possible. When she came to me, she had a long history of PCOS, multiple failed IVFs, and finally one IVF leading to a genetically deformed baby, which had to be terminated in the 5th month. And you can read her story in detail on my website and on my YouTube channel. But I just want to tell you her results. So her results is like you can see for yourself. She conceived without IVF in the first try. She prepped her body for pregnancy with my 6 months program, and she boosted her micronutrient levels, corrected the deficiencies, aligned with feminine energy and 4 phases of the menstrual cycle, did the advanced gut healing protocol, and she was able to get pregnant on the first try without IVF, had a very, very healthy pregnancy, had extremely healthy babies, didn't have any gestational diabetes, any postpartum depression. And this is a great example of what you can do naturally and how to be in the driving seat of your life. So the second story I want to share with you is about a case of lean PCOS and acne. And this is a story of Dr. Stuti. She herself is a doctor. And when she came to me, she is very lean, so I just wanted to share with you that not all PCOS looks the same. She was extremely lean, and she was suffering from full-blown PCOS, missing periods, and acne. And that was least of her concerns because she was also having major allergy issues and hives and rash, which was very itchy. And in order to mask those symptoms, she was taking some antihistamines, which was making her very, very drowsy and tired. So of course she did all the work. She signed up for the 6 months protocol, and then she did all the work, including changing her diet, cleaning up the deficiencies, diet, and the intense gut healing protocol. And I'm happy to report that all her symptoms went away, her periods came back, and also her skin completely cleared up. And allergy is actually a thing of the past. It doesn't exist anymore, and it as if it never existed before. It just vanished away. So 3 months is the average time I see clients from symptoms to no symptoms. And of course, women lose weight and their moods get better and cycles get regulated and blood sugar issues go away as well. The next story is about Pallavi. It's a case of PCOS and hypothyroidism. So this full-time IT professional, she came to me with symptoms of period problems. And when I did the root cause test, she had gone into a full-blown hypothyroidism. She was extremely tired. Her homocysteine levels were very high, and even the sugars were on the higher side in the pre-diabetic range. So instead of just going on the thyroid pill, she decided to do the protocol, and rest is a history. She did all the work, of course, diligently in spite of her hectic IT schedule. And within 3 months, she came to me with a healthy pregnancy, natural pregnancy, and which Under my care, she had a very, very beautiful pregnancy. She continued working throughout her pregnancy and delivered an extremely healthy and beautiful baby, like you can see for yourself. And I got a chance to deliver these beautiful babies. There are many more clients who have reversed their so-called incurable problems like their thyroid disease, APLA syndrome, autoimmune diseases, post-pill amenorrhea, acne, infertility, weight issues, perimenopausal symptoms like lack of energy, libido, hot flushes, vaginal dryness, PMS, by addressing the root cause of the problem and not just masking the symptoms with pills. And if you want to dive in detail, you can check our website, www.truehealing.com, and you can check all these success stories. And I really appreciate these women for sharing their stories. It takes a lot of courage. It's not easy to put up your personal stuff online, but I really appreciate these women because they did this to inspire other women. That is how women are. When they get something, they want to share with others. And that is a very, very unique feature of feminine energy. So ladies, I hope that you got some more insight into root cause of your PCOS now. And I have a blog, a detailed blog on the types of PCOS, and you can go through it. I did not cover it intentionally in this masterclass. Otherwise, it will become very, very long masterclass, but it's really available on my website. You can check that out. And I just want to, at the end, I just want to encourage you to make friends with your menstrual cycle, to just listen to her. Because at the end of the day, our periods are not a liability. They are actually a blessing. It's a sign that something is not right in our life, and we can actually take clues from your menstrual cycle and we can correct that. So I want to invite you to make friends with your menstrual cycle, to listen to her. And if there are some symptoms going on around it, like something as simple as PMS or cramps, which many people think that are normal, but actually they are not normal, or maybe PCOS or irregular periods or delayed period, early period, missing periods, spotting between the periods, endometriosis, fibroids, weight issues, acne, you name it. If there's anything funky going on, it is not normal. It's a sign that your hormones are not under control. You don't want to mask the symptoms with pills. You want to address the root cause of the problem. So remember that, ladies, your health is in your hands. It is not in your husband's hands, in your parents' hands, or maybe in your children's hands. Your health is in your hands. So I request you to prioritize yourself, because you cannot give from an empty cup. So when will you take the courage to take your health into your own hands? When will you sit in the driving seat of your life, taking clues from your menstrual cycle? Remember that whenever you are ready, I'll be there to help you. I am Dr. Disha, reminding you, heal your periods, transform your life, change the world. And if you're really ready to address the root cause, I am happy to help you. And the consultation link is available. If you want, we can book an initial consult to look into your root cause of the problem. So I hope you enjoyed this presentation masterclass, and I'll see you on the other side. Thank you.